I said just a second ago, we saved the best for last. I was really excited to work with EY this year. I learned a lot. I had this like preconceived notion of their years ago, what they did and what they're doing now, and the way that they are thinking is really interesting. And so I'm really pleased to welcome them all to the stage, and I will introduce everyone. We have Carol Fay. You can all come up together. U.S. Health Leader at EY, David Roberts, Dr. David Roberts, Global Healthcare Leader at EY, Christina Rogers, Global Consumer Industries Leader at EY, Dr. David Rue, the Chief Medical Officer from Samsung. Thank you.
All right. Good afternoon. I think we are, unfortunately, the only thing standing between you and a cocktail. So I appreciate your patience with us. We're happy to be here today. Our session is entitled Consumer Data, Rewriting the Rules of Healthcare. So I'd like to first introduce our panel and do that quickly because I know we only have 30 minutes, and so if I let them introduce themselves, I can't control it. But if I introduce them, I can control the length of that. So first, I'd like to welcome Dr. David Rue. David serves as VP and General Manager of Enterprise Healthcare Vertical for Samsung in the Americas. He helps deliver transformative digital health solutions that improve health and well-being for the healthy, sick, and aged to create a better world. David, thanks.
Thank you.
All right. Next to David, we have Christina Rogers. Christina is EY's Global Consumer Products Leader. She's responsible for global business leadership across multiple consumer industries, leading over 30,000 EY professionals worldwide. She has lived in 20 countries and built a very long list of clients in the consumer product industries, and some of the world's largest consumer products are her clients. She likes to help these companies solve some of their strategic marketing issues across geographies. Welcome, Christina.
Thank you.
All right. And lastly, we have David Roberts, who's the EY Global Health Leader, and I have to just pick on him for a moment. He walked in the door literally 3 minutes ago. So we are very pleased that he was here. I was about to throw his question out the window, so glad that David could be here with us. So David is responsible for the EY's global health strategy and how we are helping our clients achieve the goals in a rapidly changing health ecosystem. Really we are focused on furthering EY's goal of building a better working world. He's passionate about how consumers are having an impact on the way that care is being designed, delivered, and funded. So welcome, David.
Thank you.
I do mean that. Welcome, David. All right. We'll join the three of you over here. So first, since we're at CES, obviously we want to talk about the most important component, and that is the consumer. So Christina, I'm going to start with you. What can the healthcare sector learn from consumer product companies about keeping people engaged in their health throughout their lives? And then also, how do you see this changing as consumer products and technology companies evolve?
Yeah, good question, and then probably highly relevant, especially given the data conversation that was going on in the previous session. I think, historically, consumer products companies were the first data collectors, right? They put the consumer first. They went out and understood what they wanted, how they felt, what they needed, and then took that back and created products that met and served those needs. And we're very good at creating new needs and helping us understand that we had needs that we knew nothing about as well. And so I think they were excellent at really collecting and mining data on consumers and creating not only functional products, which solve problems, but creating emotional stories around brands. They were very good at understanding the impact that had and changing the brand story over time so that it continued to resonate with consumers. And I think there's some struggle with that today, right, in terms of the consumer wanting to be much more involved in the brand story. There's so much data out there that consumer products companies have in some ways fallen behind in terms of how they collect and capture that data. But I think there's still a lot to be learned about the way in which that they've taken their consumers and their loyal consumers on a journey, whether it's through a life cycle, a product life cycle, a life stage, continuing to update and offer us new products and services that met a need that we would have at a particular point in time. And I think many of us will see certain brands that we love and favor as real companions in our lives.
Very good. David, anything you'd like to add?
I think one thing that we're seeing in the industry is that there is definitely a focus on cost containment, improving quality, improving access to care. And when you want the consumer, the patient, the individual to take better care of themselves, you're asking them to do things that they may not have the right information, they may not know exactly the right protocols or tools, and you need to support them. So if you think about how doctors and nurses are supported, they're supported through electronic tools, electronic health records, clinical decision support. There really isn't that type of support in the consumer world. What we're finding, though, is that consumers now have access to tools that can allow us to gather information, whether it's a wearable, a phone, a tablet, incredible sensors that can be ingested, can be put on your, inserted in your body, and all of that is capturing data that could be very helpful that will allow us to be able to better understand what needs to be done. And so recognizing that to be able to get consumers to be more engaged, more informed, we're going to have to take a different approach to healthcare. And a large part of that is going to be around leveraging the things that people use every day. People use a refrigerator every day. They use a phone every day. They use a TV. They all have sensors, and these sensors are capturing information. They all have communicators, and all that communication is now going through cloud channels to secure networks with AI, and we now have an ability to really lead to more proactive care.
Very good. David, anything you'd like to add to that?
No, I find this whole thing very interesting, and as Christina said, that it's been a long time that consumer products organizations have been training us and educating us about what that process is. And I think we finally reached the point where healthcare patients actually recognize those traits, those trends, they recognize those brands, and they actually want that same thing from the way they receive and deliver their care. So what we heard just from the technologies that you've described, they're becoming pervasive in the way that we live our lives, and as a part of that, pervasive in the way that we see our healthcare being played out for us in the way we deliver care and wellness for ourselves.
Very good. Well, we certainly, over the course of the last couple of days, have heard a lot about, again, consumer products and how they are interacting with the healthcare enterprise. So now moving on to a little bit different topic. I want to talk about how healthcare is changing. I think we're very excited about, as we see healthcare moving forward, the concept of care anywhere and connected care. So David, can you spend a little bit of time talking about how you see the future health ecosystem? What do you think it looks like, and what roles these products are going to play in consumer electronics are going to play in that ecosystem?
Yeah, for sure. And look, this is going to be a pretty educated audience, a high propensity of people from the US here as well, who will recognize some of what I think is happening and what's going to happen, because parts of it are happening in our own economies. But we have moved to the era where consumers are much more demanding of what they require from their healthcare provision, the healthcare providers, and the healthcare payers, actually, the whole continuum. That journey is actually forcing the healthcare systems of the world to rethink what they're doing and to embrace a whole raft of new technologies and solution sets. And at the same time, we're finding the world is changing very rapidly. Just the technology in this place at this conference is just phenomenal and mind-blowing. And yet we're beginning to gradually work out how we apply those things into things like our more traditional healthcare systems. Now, what we're finding is that the emergence of quite sophisticated ecosystems where traditional industry players are recognizing that they now have a part to play in other industries, in other businesses, and in other delivery modes that they haven't traditionally been in. So, people in the room will recognize retailers actually beginning to provide primary care, insurers providing wellness and prevention care, pharmaceutical companies providing chronic disease programs, technology companies believing that they can actually provide service profiles for organizations is now a norm. The question is, how do we find a way of embedding that norm in the day-to-day practice? And I think we've got an awful lot to learn from consumer product organizations and the way they've executed on that. But we're also finding that there is a substantial amount of what I would describe as glue that's missing from this entire system. So we have many point solutions out there that you've again heard of today, things that do something pretty neat for you that may well solve a particular problem. They may well give you an indication of diagnosis. They may well actually help support you receive care in an alternative location, which is a big trend. But what we don't have is a universal way of actually connecting that stuff to a comprehensive set of knowledge around what we're trying to achieve. And I think that is the panacea that we're going to. These ecosystems are actually starting to coalesce solving some of those problems. And they're starting to solve some of those problems with very, very different solutions and very, very different intents to the ones we previously had. Now, how governments for publicly health-funded systems, how insurance companies and how employers actually address that, it's going to be really interesting over the next few years. And I think the research that we've done, the conversations we've had with consumers directly, with stakeholders, indicates to us that the expectation of those people is not slowing in any way, shape or form, it's speeding up. And so the rapid assimilation of multiple business types to solve those problems is growing. And I find that quite fascinating, but I don't think our healthcare systems around the world are yet anywhere near able to cope or address what will be an onslaught in terms of these new solution sets moving towards them, driven by consumers and enabled by this rapid advancement of technology. So it's a very different world out there. I think it's a very exciting world. I mean, I'm going to go home very much poorer, having spent so much money on wonderful devices that can tell me everything about my body, and it's a pretty poor body, but for my body during the course of this week. The important point, though, is technology has reached a point where it can do things that we previously wished and hoped for, but it's doing them. But it's doing it in a point-to-point way rather than doing it in a holistic way. And that's the big next shift for us, using consumer technologies, using devices and technologies, using consumerism and embedding that in a solution set that give us a comprehensive way of delivering care that we haven't seen just yet.
Well, I think it's interesting. One of the speakers, I think it was yesterday, made a comment about can an app be prescribed in lieu of a pill. And, you know, when you just start thinking about that and how that will really change the way we view healthcare and how we are actually addressing our healthcare needs, I think it's an amazing thought. Christina or David, anything you'd like to add to Dave's comments?
Well, one of the things that we've seen is there is a convergence. There's a convergence between hospitals and payers, and they're becoming all in one. We're seeing a convergence of retail, clinic, and healthcare. We're seeing a convergence of consumer technology and healthcare. But at the same time, there has to be an adoption of some of the things that work within the healthcare system. So for instance, if we're looking at a consumer product, now we're dealing with data that needs to be secure. That wasn't a consideration when we were dealing with consumers before.
Yep.
We now have to think about it. We need to think about the fact that it's simply providing technology by itself doesn't make it engaging. You know, what's the need that you're solving? You know, are you just giving data? For some people that works, but for the vast majority, if you're telling me that I can wear this because I can live independently, or because it allows me to be able to do certain things that I couldn't do before, then I'll do it, but otherwise I won't. So we have to get to the motivation. We have to understand what is it that drives people to want to use these consistently and regularly, and then be able to put in all the parameters that allow us to be able to securely move data so that data works within the healthcare system. And it's not just the consumer, it's the provider, and it's all the other stakeholders that are used around there to use to manage this. So it's a complicated system, but we're heading to a direction where everyone's starting to recognize the rules of the road, and we're starting to see some really significant advancements.
Yeah.
Carol, I would say, you know, interesting the points you've both made, and I think putting the consumer and at the very heart of what it is you're offering them, you know, and where are they finding their corollaries in terms of their expectations. So even if you think about healthcare delivery, how generations that are kind of growing up behind us, the expectation about the immediacy of information and solutions, and the expectation that data, technology coming together will provide a solution, right? A bigger solution than just solving one problem, but a solution in totality. So whether that is, you know, believe it or not, things like, you know, if you're into Horizon watching, you know, what is meal kit delivery service doing, right? It's providing me a full solution. I don't have to shop. I don't have to do, you know, I don't have to do this, this, and this. It's a solution. Similarly with subscription lifestyle, you know, elements, whether it's, you know, shopping and providing me a consultant, providing me a look, providing this, providing that, providing makeup, all of these things are influencing the way consumers and I would say probably more so younger generations are thinking about the expectations of service and product delivery. And typically it is more and more around a solution. that's bigger than solving one problem. And I think for healthcare delivery, knowing that there's so much in the way of apps and technology, that's all great, and as you said, point to point. But what is the larger solution that all of these can come together and solve for me, whether that brings together nutrition management, weight management, emotional well-being, fitness tracking? How does it all come together? And then, of course, there are the more serious aspects of disease management or whatever it is. But I want that as a consumer nowadays to be all in one place and delivered to me as a full-on solution. Whoever can figure that out and create the ecosystem with the right players in it, I think will win with consumers that are growing up in a world that they looks and feels like that in many dimensions.
Well, I think we've talked a little bit about data, so let's move on to more discussion around that. So obviously there's a huge variety and volume of data about healthcare consumers that's now available today. But let's talk about how we use that, the utility of that data. So Dr. Wu, from David, the other David, from your perspective, what sorts of consumer data are you most interested in, and how will we unlock the value? And thinking about that, what possibilities do these new data sources create that you as a physician are most excited about?
Well, one of the things that I think we're seeing, and this is something that we hadn't recognized would be an issue when we first launched the medical records years ago, was that the information needs to be brought together in a way that we can combine it, we can normalize it, we can understand it contextually. When you have siloed data, it doesn't work. And with the more recent advancements with the 21st Century Cures Act and the big push from CMS and the ONC and a variety of other groups to enable this data to be brought from siloed spaces such as the electronic health record onto your smartphone, into a cloud environment, onto technology devices, the consumer now has access to information that they can use in collaboration with other things such as their lifestyle data and the sleep and the activity and all the other things. And so what we're starting to see now is an opportunity for real data aggregation, democratization, normalization, and really deep understanding of that. And that's what's super exciting right now, because we're at the point where before it was set up in such a way that organizations could hold on to their data and feel pretty comfortable that was their business model. It's being disrupted. And it's being disrupted in such a way that consumers are now being put in charge of their data. What we need now is an opportunity, once you do that, to be able to better understand it and be able to draw the insights from it.
David, anything you'd like to add to that?
Look, I completely agree with what David said, and I think going back to Christina's point earlier, what we know is that there are many answers to healthcare challenges, whether they be the serious illnesses and disease that we encounter, or the behaviors and the traits that lead up to us becoming poorly or ill around chronic diseases, our own attitudes towards food and health and life. What I do think is really interesting, though, is this notion that we believe health records actually center around the illness systems that we have. And in fact, we have a problem here. In fact, that isn't what is going to start to solve some of our problems downstream. So again, I go back to that notion around the technologies that we've seen, and they're prolific. The amount of private equity investment and venture capital money going into new devices and technologies which create another siloed piece of data, which is very insightful at a particular incident or disease level, is actually not then able necessarily to be leveraged against an individual's total well-being factors. And I think that is the move that we're going to start to see. So these bigger data sets of traditional data aligned with new data, this data fusion of the machine data with the biological data, is actually where we're going to start to see some major inroads in the insights that we have around what we can do to influence our care, influence our well-being, and influence our attitude towards preventing illness or serious illness. We can't ever forget, and we shouldn't ever forget, that our healthcare systems are a vital part of our infrastructure in society, and they're going to go through a big change. But I do think the biggest change is actually going to start in the way we create new healthcare wellness models out in our communities in various parts of the world. I would also say that there are some parts of the world that are going to be slow to adopt and embrace some of this stuff. There are other parts of the world that at this point in time are more free and able to create new ideas, new thinking. And it may well be that we start, in the Western world, start to see some pretty interesting solutions emerge from different parts of the world that don't necessarily have the same attitudes towards the way we receive care. And I think we should all be very open-minded to what happens in different parts of the world, and how they may actually begin to embed and the use of technology, the use of data to actually answer some of those questions.
Yeah, Carol, I would say, as a consumer or a patient in this case, I want to be part of that though, right? That's the expectation that I have, is that I'm so much a part of anything else I do in my life now. I'm empowered, as you said, with the data. It's in my hand, it's wherever it is. And if you think about other industries, think about sportswear or fashion and so on, people are out there co-designing products with organizations, right? They're putting their stamp on it. They're out there being able to customize and personalize and be part of the whole system and really be in the driver's seat. And I can imagine that, healthcare is not my space, but that must be happening already. And certainly the demand to be a central figure in the middle of that entire system must be there, and will only increasingly be so as we, all have customized food to our DNA or whatever it is. I mean, that's a small part of the whole healthcare and wellness system, but I can only see that demand to be a central figure, right, in all of this increasing. Whereas, historically, there were people who were health providers, and they were kind of sat up there, and we listened to them, and we took our medication if that was the end of the story. That's very different, certainly in many consumer industries, and I can only imagine it transitioning to, I don't know if that's good or bad as a doctor, but I'm sure you don't like, when we come in with our Google.
Not. Actually, if you're thinking about what's best for clinical outcomes, higher patient activation, patient engagement is better for patient outcomes. It's been proven again and again, lower readmissions, lower cost. But how do you get individuals to become more engaged? There are barriers. There's informational barriers, there's educational, there's language barriers, there's barriers of right information at the right time. So all of this could potentially be helped by technology, and that's what we're seeing. We're seeing technology being able to give that guidance. A really good example is that we work with a partner that has done a randomized controlled trial of coaching for diabetics. And what they found is that in this study, the coaching for things that lifestyle related, even medication timing, they found a reduction in hemoglobin A1C of close to 2%. And that's the measure, for those that aren't as familiar, of like how poorly or well controlled your blood sugar is. Just to put that into context, if you were to go and look at the FDA drugs that are cleared, oral drugs for diabetes, it reduces by hemoglobin A1C by 1%. So we're really saying adherence, patient engagement, is like twice as effective as medications we use today. It's an unutilized element of our healthcare armamentarium. Getting patients to become more engaged, using the tools that we have. Digital tools are a part of it, but also being able to bring the information to them real time, allow them to make smarter decisions.
Well, I think it's interesting because we've done some surveys of consumers, and right now I think there's a preponderance of they're interested in sharing their data for convenience. If they're incentivized, that's incentive, is that convenience and their care is more convenient to them. That's a really sad sort of threshold to think that they're not really that concerned about quality at this point. They're really just thinking about the convenience of how they get their care. So we've set the bar fairly low, I think, to be able to really beat the consumer's expectations as to what can happen if they really do get engaged in their care and share their data.
I mean, a very common example is if a patient came into an ER and they were traveling, let's say they're here at CES and something bad would happen, you're outside, the doctor knows nothing about your medical record. Let's say you're unconscious, let's say you're not able to communicate. They're gonna have to start from scratch, order everything. They won't know about your allergies, they don't know about any of that stuff. But if there was some way that you had to be able to immediately communicate so that they started from what we already know, that is really what we're looking at as a starting point of value proposition. But it's really just the beginning, because once you have that and you combine that contextually with the lifestyle data and the others, we can draw some really insightful recommendations that will allow us to become more in better control of our own health. And that's where we're really trying to head towards. We want to be able to take that information, be able to combine it with others, but empower the consumer with that information so they can make the decisions.
Yeah.
Very good. All right. Well, with that, we have I'm going to do throw something at you guys. So we've actually are slightly ahead of time, and so maybe we'll get you to cocktails just a few minutes earlier than we would have. But how about just a key sort of takeaway that you guys, each of you, starting with you, Dave Roberts, since I work directly with you, I'll put you on the spot first, about this concept of our topic, consumer data and rewriting the rules of healthcare. Is there a key takeaway that you'd like the audience to think about? Related to that, just a thought that you have, if you'd share that with us.
For me, I would say you cannot leave this event and not be inspired by the fantastic technologies that are emerging, that are here, and they're emerging in the potential. But if we fail to embed those technologies in a holistic form of the way we deliver both health and wellness to our consumers, our people, our citizens, then we will fail them, and those technologies will go unaided and wasted. And the data fusion component of that, the ability to actually use, utilize, understand, and analyze that data to actually help us live better, healthier lives, I think is the key to it. So let's keep enabling this technology to be thought about, to be created, and to be put into the marketplace, but let's also figure out what is going to be required to enable us to utilize them effectively in holistic care.
Very good. Christina?
Yeah, I'd just like to pick up on this notion that better outcomes are more active and interested and engaged patients or consumers. And I think it's really fascinating as a topic, because one of the things that in some of my work we've been exploring is how a lot of the technology that's out there, particularly artificial intelligence companions and that sort of thing, can make us quite passive. Right? So if I can outsource so much of my daily routines or my thinking, my life, whether it's nutrition, in the context of health, managing nutrition or steps or fitness or this, that, and the other thing that I might choose to delegate, set parameters around and delegate, what part then of the whole health and wellness personal management am I active in? Because I think there's definitely a danger of a lot of the tools and technologies, in fact, making us quite passive. We think about things that, are mundane. So I've spent a lot of time thinking about, the split between shopping and buying and how much shopping we outsource and we save, the buying we outsource, right? The mundane tasks of buying things. And if there's sort of some exciting things I want to shop for that are personal to me and interesting, I'll do that. And in healthcare and managing my own health, I'm guessing there's plenty of opportunities to outsource all kinds of management of things. Whether I pay attention to it or not, or respond to the nudging that it gives me is a different thing. So I think it'll be interesting to see, well, what part then remains active? What part do you as a provider want me to be active around, and how do you encourage that in the future? I think it's an interesting topic to explore.
I think the one thing that we hear again and again is that data does not motivate. And what you need to do is you need to understand from the consumer's perspective, they want recommendations, they want insights, they want to be able to do something that they couldn't do before. And if you just simply give them steps data or EKG data or others, in large part they don't even know most people don't know what to do with that, and they wouldn't want to do with it. Doctors don't even want that. So what you really have to think about are, what's the problem you're trying to solve? Are you trying to better manage your diabetes? Are you trying to manage your lifestyle around certain things? Do you have an addiction to certain things? What kind of support do you need? What are the programs? Digital tools allow us to be able to implement programs that are highly sustainable and successful. And then you'll use sensors and data will flow and you'll draw insights from it. But if you're expecting the technology to solve it, it's not going to work. Technology never solves a problem by itself in healthcare. It usually is a facilitator. It enables us to do things in the context of analytics and programs and a variety of other things. And in clinical support, and oftentimes is often required, but we need to think about ways to scale it.
Very good.
Great.
Well, I think we're actually a couple of moments ahead, so we'll finish now. I want to thank David, Christina, and David for joining me today to have this conversation, and thank you all for joining us this evening.
Thank you.